Have you had any dental surgery recently? Then this video is for you. After the surgery, the patient is usually given a cotton ball to bite on the surgical site. The cotton has some betadine and saline in it, and the patient is instructed to bite on it for at least 45 minutes. This ensures a stable blood clot and restriction of bleeding. During this time, whatever juices come out of the cotton, which may be saline or betadine or blood, the patient has to swallow it inside without spitting it out. After 45 minutes, the cotton is taken out and the patient has to throw it and have something cold immediately. Options in cold food include ice cream without nut, non-aerated juice or cold milk. Patient next has to have his first painkiller and can start applying ice from outside on the affected site. The ice also helps to reduce your inflammation and restrict bleeding. First 24 hours, patient can have any food, but it has to be soft and cold, such as dal with rice, khichdi, curd rice. The patient cannot use straw to ingest liquids for the 24 hours. They have to put it in a glass and have sips. First 24 hours to 48 hours, the patient is not allowed to brush at the site of surgery. Rest everywhere the patient can brush. Patient cannot spit vigorously for the first 24 hours. So the patient can take water in the mouth. Instead of gargling, the patient can only shake in this manner and leave water from one side. After 24 hours, for the next 48 hours, patient can shift to warm food, but it has to be soft. Remaining instructions are how it is on the first 24 hours. After 48 hours, the patient is instructed to rinse with lukewarm water with a pinch of salt in it. This helps to clear whatever food debris is there at the extraction site. Salt also acts as a natural antiseptic. After 2 days, the patient can clean that site with toothpaste put on the finger. But avoid toothbrush on the affected site because sometimes the dentist gives you sutures. The bristles should not get stuck in the sutures and should not hurt. Sutures, if given, are usually taken out after a week once adequate healing is done. And for 1 week, patient should not do any vigorous activities such as dance, Zumba, aerobics, heavy exercises, CrossFit. If the patient practices yoga, he or she cannot do breathing yoga such as pranayama or kapalbhati. If there is any other issue, immediately contact your dentist.